Hey everybody, my name is Jason and I'm 55 years old now, and at 52 I was diagnosed with prostate cancer that had metastasized to my spine, and on this channel we talk about it. So today I'm out fishing. I'm out fishing with Jeff. Jeff, say hey.
Hello.
We're out on the beautiful Columbia River. Let's see if I can get some shot of the sunrise. We're gonna do some salmon fishing this morning, but I just haven't done a video where I just talk to everybody, and I've had a lot of things going on, and a couple appointments and some information I need to share. So the job, let's start with the job. That was one of the biggest changes that I've had in the last this whole summer. I went from working at the nuclear power plant to working full-time at the college, and it's been different in a good way, in a very good way. I'm really enjoying it. It's busy. I did an interview with Dr. I can't remember his name now. Dang it, brain fog. And he was a professor. He's a professor at a college, and he was talking on our episode about how busy he is all the time, and I feel that. I absolutely understand now. But anyway, I don't want to babble about that too much. It's a good change. My quality of life has gone up, and that's why we do it. That's why I did it. That's the important thing from that. I had my appointment with my medical oncologist the third week of September. I did my PSA, do the lab work, and then do the. How far out you going? 70?
No, we're only at 25 feet right now.
Okay.
These things with that weight, they go straight down.
Okay, thank you. And then, so my blood work came back good. My PSA is still undetectable. What was different was my I had a different medical oncologist. And so I was talking to the medical oncologist, and she saw some notes from previous conversations about things that I have talked about on here before, like, hey, what about lowering my meds? How am I managing the symptoms? And for me, the biggest thing has been the cognitive effect. It is so incredibly noticeable and so challenging, and the brain fog, the memory issues, the overall cognitive stuff. So I talked about that again, and she said, well, are you doing the reduced dose on your abiraterone, the Zytiga? I said, no, the medical oncologist didn't recommend it, and I just got nervous based on some of the things she said, like, hey, if you lower the dose, you might become more resistant sooner. And I later learned that you don't become resistant to the drugs. There's a protein, I think IL-8, don't quote me on that learns where it triggers your cancer to learn to thrive in a low testosterone environment. So it doesn't matter what drugs you're on. It's not becoming resistant to the drugs. It's becoming resistant to the low testosterone environment. And she said, the studies for the 1,000 milligrams, there's a lot of studies. She says there's minor studies at lower doses, 750 milligrams and 500 milligrams. And she says some men take it with food, like they take a lower dose, they take it with food, and there are some supporting studies, not as much. The reason they give you 1,000 milligrams is because that's what all the trials have all the data on. So, but she said this medical oncologist does have some patients that are doing a lower dose and are doing well, doing slightly better, not well, right? And so I have cut my dose. I cut my dose that next morning after talking to her. What she said made sense. I went and reviewed some of the data that I could find, some of the 750 or 500 milligram data. There's not a lot out there. but there is data saying that it still works. And so yeah, I've been doing 750 milligrams a day since then. Today's October 5th. And maybe it's the placebo effect, but I feel like I am doing a tiny bit better cognitively. So I'm going to keep doing this, and then we're going to monitor. So, but I'm babbling about that. I want to get to the biggest thing she said. The biggest thing she talked about is I was saying, yeah, I left my job because of the cognitive effects. I need improvement here. And she said, well, why don't we switch your drugs? So what are you talking about? She said, yeah. And I think Adam's talked to me about this a couple of times, and I keep forgetting to do something about that. She said, there's a drug out there that's called Firmagon. And Firmagon, men seem to tolerate it better with fewer cognitive effects, fewer cognitive issues. And there's reduced heart risk, right? These drugs, the treatment that we're on, can give us the Lupron can cause heart issues eventually. And so, I don't want that. And so I'm like, well, what's the downside? Why, if that's an option, why wasn't that my first option? Why are we just now talking about it? And why didn't my other medical oncologist bring it up? She says, well, a lot of medical oncologists don't pursue Firmagon because men don't tolerate it as well. What do you mean? Worse side effects? She goes, no. Instead of a shot every 3 months that's intramuscular, Firmagon is a shot every month in your stomach, and it's subcutaneous. And she said men seem to prefer the 3-month intramuscular shot. She says the one in your stomach, the subcutaneous shot, every month it's more painful. You get more redness, you're more sore from it, and you have to come and do it every month. I'm like, well, what did I didn't use a quote. What went through my head? What's the movie? The Replacements. Keanu Reeves. Pain heals, or pain doesn't last. I forget. Now I can't remember. Pain's temporary. Chicks dig scars. Glory lasts forever. Something like that. I thought, for improved cognitive effects and reduced risk on heart issues, I'd like to try it. She says, well, don't decide now. Just go home, do your own, look it up, read some papers, and then send me a message in a couple weeks. She says the challenge is it's more expensive, and insurance will often deny it in favor of Lupron, because Lupron's cheaper for them. I'm like, all right, but it's worth a try, right? And she said, yeah, if it's what you want to do. So I went home and I looked it up, and I decided I'm going to try and put up with 1 month shots in my stomach to see if I can improve these cognitive side effects. Let's hope. I'm going to try and show you that sunrise. Look at that. Isn't that gorgeous? Oh. So, yeah, that's the biggest thing. Well, those are the biggest things. But I also have an appointment this week. Today's Sunday. On Wednesday, I'm seeing an endocrinologist. And I want to pursue weight loss. And they said I need to see an endocrinologist to see if there's any options there for me. I'm nervous about the idea of maybe doing some of these GLP-1, the Ozempic and stuff, but there's one, and I forget the name, it starts with a T. I'll butcher the name if I try and do it, but it seems to be a little more promising, and so maybe I'll try that if that's an option. But I want to see what the endocrinologist says. I want to see, are there options out there for me or not? So I'm hoping there are. I'm hoping because I need to, there's a cycle, right? You eat well for a little while, you feel good, you feel better, and then you don't eat well one day. And then that starts the cycle the other way. And I have definitely gone the other way again. Eating like garbage. I think what I ate yesterday was, I had some chicken wings for dinner. Other than that, I had donuts and cake all day. It was my birthday weekend, though, to be fair. So, and it's Jeff's birthday coming up. We got a combined birthday party this coming weekend.
It's our birthday month.
Birthday month. So, yeah, it's gonna be awesome. So I need to get back on track. My impulse control is so bad when it comes to food, and I need to do something about it. So that's what we're going to talk about with the endocrinologist about. What else have I got going on? The school, I'm going to switch drugs. So she said, when I come for my next shot in December, hopefully it'll be Firmagon. And then from that point on, I start the monthly shots. And if not, well, I'll let you know, and we'll see how it goes. I do intend to keep doing my abiraterone at 750 milligrams, and I'm going to try and do it for the whole 3 months up until my next shot in December. And because she said, I did it for 4 days or a week, and then chickened out. And she said, well, you're not gonna notice anything. She says, if you really want to see if it helps, you've got to do it for a long time. You got to reduce the dose and do it for a few months. So that's what I'm going to do. But yeah, look at that. So I'm just going to enjoy the day. I'm going to be fishing on the river with Jeff. And yeah, I think that's all I got today. I just wanted to give you all an update. All right? Stay healthy. Love you all.